My name's Biral Patel. I'm a consultant urological surgeon based here in Gloucestershire, working out of Gloucestershire Hospitals NHS Foundation Trust and also the Nuffield Hospital in Cheltenham. I've been here since 2007 when I was first appointed a consultant. Well, slightly stereotypical, I guess. I was born in a family of doctors, and when I was growing up, most of the family and family friends were even the doctors, and so I was always exposed to medicine, always had an appreciation. But as I got older, I guess I started looking more into it. What really struck me was the privilege that the profession brought. Privilege in terms of the ability to help people during vulnerable times of their lives, playing a big role in the lives of people, often during very difficult circumstances, and actually the ability to make quite a big difference to the lives of patients. So really, that's what it was. I have to say that I've always had an inclination towards surgery. I've always been a practical sort of person, and so surgery always appealed much more. But really, once I qualified from Bristol and started doing my basic surgical training, I had exposure to a whole variety of surgical specialties, and the urologists were the people who struck me as being some of the nicest, friendliest people. So that's what certainly helped inspire me, really. As I went along doing more training, it became apparent that urology was actually an interesting specialty in the sense that there was a whole wide variety of conditions, treatments, and even varieties of surgery. So as a surgeon, we could take on things like laser surgery, endoscopic surgery by inserting cameras into the bladder, but also doing major open pelvic surgery, major open surgery to remove kidneys. And these days now, of course, robotic surgery, which has now become my subspecialty. So really, it was those sort of things. But also, I've always believed that urological problems tend to affect a patient's quality of life, perhaps more than a lot of other surgical problems or medical problems. And so it was actually the ability to make a difference to that, which I also found really appealing. Well, I think I can sum it up in one word, actually, and the word that comes to mind is relationships. We build fantastic doctor-patient relationships with those who we're caring for, amazing relationships with colleagues and people at work, that's doctors, nurses, and all the other staff. It's extremely rewarding. And finally, the relationship with the trainees. I have done a lot of training of junior doctors, and in fact, at one point for several years, I was overseeing the training of urologists in the Southwest. And that was something I found particularly rewarding, the teaching. So really, relationships for me. Well, mantras, that all sounds quite sexy. I think I have a couple of principles that I try to stick to. The first one is that I always try and treat my patients in the way that I really would like and expect to be treated if I was seeing a specialist. I would always try and do the best for my patients, but also as a surgeon, I think one needs to appreciate that surgery is not always the answer. And so as a surgeon, I think I would like to think that I know when to operate, but also when not to operate. And those are all important things.